My name is Professor Leonard Funk. I'm a consultant shoulder and upper limb surgeon and professor of orthopedics and sports medicine. I'm going to talk to you about shoulder arthritis. Arthritis is typically wear and tear, a degeneration of the shoulder joint. The joint becomes stiff, it becomes painful, and it can affect your activities of daily living and your sleep. There are numerous treatments for shoulder arthritis, and we'll run through some of these. Non-surgical treatments include physiotherapy, keeping the joint mobile, keeping it active, and trying to retain a range of movement and the strength in the joint. Painkillers and anti-inflammatories are very helpful as well. Injections may be useful to temporarily help the pain relief, and sometimes courses of hyaluronan injections have been shown to be beneficial for slightly longer term benefit. For those people that have severe arthritis of the shoulder joint, as we can see over here, where the normal joint is nice and smooth, but the arthritic joint is very irregular and typically very worn. These type of shoulders generally benefit from a shoulder replacement to help with the pain control. There are different types of shoulder replacements, and your consultant surgeon will discuss the best type of shoulder replacement specifically for you and their personal preference with you once a decision has been made for shoulder replacement. Generally, you'll need to be in hospital for a couple of days. The operation is performed under general anesthetic and/or with a regional anesthetic where your arm is made numb during the operation. The operation is done through a surgical scar. This generally heals very well. You will need a sling after the operation for approximately 3 to 6 weeks, depending on your surgeon preference, and you will be largely one-handed for a period of that time, although you will be able to use your arm for simple activities. It does take time to fully recover from the operation, and you will need physiotherapy as well. As with any operation, there are small risks and complications, and these will be discussed with you by your consultant surgeon at the time of surgery. We'll now have a look at some of the shoulder replacements, the broad categories that are used. This here is a surface replacement of the shoulder. And here what is done is just the surface of the humeral head is replaced by a metal joint. This has advantages in that very little bone is resected, and it can be done through a less invasive approach to the surgery. It's generally very good for younger people who don't need a total shoulder replacement. Here we see a typically total shoulder replacement. This is a stemmed total shoulder replacement where both the humeral head has been taken out and replaced by metal, and the socket of the glenoid has been replaced by a plastic liner. Again, your surgeon will discuss which is the best for you in your personal situation. Another type of shoulder replacement is known as the reverse shoulder replacement. This is slightly a bit weird because here what you have is the ball is on the socket side and the socket is on the ball side. This is an excellent operation for improving pain and range of movement for certain people who have a condition known as cuff arthropathy. Here you see a typical cuff arthropathy. The rotator cuff is gone, which has been the muscles that stabilize the shoulder joint, and the humeral head has gone up. So therefore, there's very little function of the shoulder. The reverse shoulder replacement has some clever mechanics so that it allows you to get some more movement with the shoulder in this reverse geometry. But this does come at a cost. As you can see, it's a very big operation, and it therefore has slightly higher risks and complications than the other ones. It also is fairly new and may have a limited lifespan, and is predominantly of benefit for patients with a cuff arthropathy who are elderly. Naturally, your surgeon will discuss this in more detail with you when such time is required. For more information, please go to the website shoulderdoc.co.uk and have a look under the patient information section under shoulder and look at arthritis, or click on the link below.